Okay, Assalamualaikum, selamat pagi. First of all, thank you to emergency departments for invite untuk beri sedikit penerangan tentang Paxlovid lah. So I think all of you know that Paxlovid is one of the much awaited drug for COVID. Macam Dr. Azman cakap tadi, memang actually last week we have received 3,500 patients worth of supply for HKL sahaja. So it is actually meant to be used for outpatient setting, yeah? Because the purpose of Paxlovid ni adalah untuk prevent hospitalization and also disease progression, mortality and whatnot. So basically it is meant untuk kegunaan di outpatient lah. So especially in emergency department, if we talk in terms of hospital and also the klinik-klinik kesihatan dan CAC. Untuk prevent them from coming in. So I'm just going to briefly talk a bit on Paxlovid, what's the evidence and the data and whatnot. I think yang paling penting is actually Wilson will actually talk to you all about the flow on how to prescribe, and also there will be a checklist, things that you have to go through lah. Yeah? This one just a recap. You all know this very well. I know by now that the early part of the disease is always the viral response. Towards the end is host inflammatory response. So Paxlovid ni adalah antiviral, so it should be given earlier. Yeah, it should be given within the first week of illness to halt the viral response phase. So looking at this, we know that now Omicron is a predominant strain, yeah, worldwide, just not in Malaysia. So it has sort of, overtaken Delta. And we know that in Omicron, the punya symptom onset too is much shorter compared to different of the previous Delta strain that we experienced masa that peak in July, August tahun lepas. So Omicron, because of the high rate of transmissibility, so the shorter exposure, the exposure to the symptom onset is much shorter. So if you look here, there was a paper in Korea looking at what we call serial interval, maknanya the infection and also the development of the symptoms and signs is generally within 3 days. Yeah? So they get really fast. And there is also data showing that Omicron is higher transmissibility compared to Delta. And a bit on just reinfection. As you know, we used to always say that kalau you dapat COVID 90 hari ataupun 3 bulan lepas tu, you shouldn't. But I think more papers looking at reinfection, and we have come into conclusion that we take now about 60 days. Yeah. So generally kalau you dapat new symptoms or new evidence in terms of PCR ataupun RTK beyond 60 days, so you may have to think about possibility of reinfection. So I think ni pun you all are quite familiar who are at risk of getting severe COVID, especially those who are immunocompromised. So immunocompromised memang ada definition dia lah. So as listed here, and also from studies looking at risk factors associated with severe disease, especially the unvaccinated, the elderly, and those with comorbidities would actually those how at risk lah to develop severe disease. So now that we are talking about Omicron, the way how it behaves is much different compared to Delta. When we had that peak in July, August tahun lepas with the Delta strain predominant, we see a lot of them coming in with severe pneumonia. Yeah. But nowadays, Omicron is sort of more mild because we know that they are predominantly, they get URTI kind of signs and symptoms, and they don't have that pulmonary phase as opposed to Delta. So they don't get really bad pneumonia, yeah, compared to what we used to see before. And more so if you have been vaccinated, dia punya phenotypic, dia punya manifestation tu lain sikit. So it's milder, yeah. Compared to those, of course, we do see at times, sometimes, yang sekarang ni datang dengan COVID, they develop severe pneumonia, but these are mainly amongst the unvaccinated, yeah, unvaccinated and those who are elderly, yeah, generally 60, 70 years and above, and those who actually received 2 doses of Sinovac, somehow, you know, they tend to progress to severe disease. Tapi the thing is about this Omicron, even they get severe pneumonia, diorang tak macam dulu where you need to give steroids for a long time. Usually you give 1 or 2 days of steroids, they improve. Yeah, so it's sort of reassuring to say that what we are dealing now is much milder compared to how it was before. Okay, so kalau you tengok dekat NIH punya timeline ni, daripada tahun since COVID hit us until now, there are just so many advances and treatment strategies on how to go about with this COVID. So kalau kita tengok dekat sini, before the COVID starts, there is a drug called Evusheld that can actually be used as prophylaxis, but I think it's still on trial. It's not in Malaysia yet, but they were looking into whether, you know, it's more like a prophylactic kind of treatment before you get COVID. And then of course, the topic today is about antiviral. The early part of the disease, generally the first week of illness. So there will be some role of antivirals here. Those days, as you all remember, we used to use a lot of favipiravir. Sekarang dah tak ada because we know there's no evidence on that. And then we move on to remdesivir. We still have remdesivir in the ward that we use in patients in the early part. And then of course now we have this new kid on the block lah, this nirmatrelvir, ritonavir, or our Paxlovid. Yeah, and then there's an alternative called molnupiravir. I think diorang dalam plan nak beli, tapi tak ada ni lagi, tak sampai or something like that. Then of course there are also other antivirals, but some of them are not active against Omicron. So nanti I'll just show you the latest guideline on the antivirals. And then of course you have remdesivir, and then if you progress into the second week of illness where they hit CRS, then of course your antiviral would have no role here, and then you have to play around with your steroids and your immunomodulators. So what is recommended here, siapa yang tak perlu masuk hospital, so i.e. emergency, if they come as outpatient and they do not need oxygen, so they should be offered symptomatic management. So as long that they come in the first week of illness, they should be offered antiviral. If there are no contraindications, nanti Wilson will go through with you what are the contraindications. And not everyone needs it lah. So because it's not cheap, this ubat. So for us, we have ways on how to risk stratify siapa yang betul-betul perlu je antiviral ni. Bukan semua orang datang dengan Cat 2, Cat 3, first week of illness dapat Paxlovid. Okay, so is in the guidelines says that Paxlovid first, and then of course second is remdesivir, which we have, but remdesivir is IV, bukan oral, so patient kena masuk ward leceh lah. And of course alternative, kalau you tak ada ni, you can try this batelovimab, which kita tak ada. Molnupiravir is in our guideline, tapi memang tak ada kat Malaysia lagi. So these are some of the antivirals. Okay, so this Paxlovid ni combination, yeah, you have this antiviral called nirmatrelvir and ritonavir. Ritonavir ni is actually a booster. Okay, this is actually the antiviral. So I will just simplify the ni. Basically, we have this 3CL-PRO ni is actually a protease in the virus. So nirmatrelvir ni, it will actually slows down the viral replication. So it sort of inhibits this protease because it's a protease inhibitor. So it inhibits this protease, this 3CL-PRO, then the viral replication will slow down, and then viral load will become less, and then ultimately the severity will be less, and then quicker recovery. All right. Ritonavir ni, kerja dia is just to boost the effect of nirmatrelvir, because ritonavir is this CYP3A4 inhibitor. So it inhibits this enzyme, so that enzyme would not degrade this nirmatrelvir, so then nirmatrelvir ni boleh berjalan dengan lebih bagus lah, right? So the issue is that this ritonavir, this CYP3A4 enzyme ni, dia akan banyak drug interaction dengan ubat-ubat lain sebab dia enzyme inhibitor. So there will be some important drug interactions that you have to be aware of bila you nak start Paxlovid nanti. I think nanti Wilson will go through with you. Just a brief one, this would be the landmark trial on the usage of Paxlovid. It's called the EPIC-HR trial. So basically, it was enrolled within the 5 days of symptom onset, so early disease. Those who have more than one risk factor for progression to severe disease, mainly the risk factors, the age, and they've never had any prior vaccine or prior infection. And but just bear in mind that majority of the variants in this study were actually Delta. Okay, so we don't know at that time whether it would work now because we are mainly dealing with Omicron. But the company, the Pfizer, actually came up with some data I'll show you later that is actually effective for Omicron as well. So diorang nak tengok bila start Paxlovid in this cohort of patients, they want to look at any COVID-related hospitalization ataupun death within the 28 days. Yeah. So looking at here, the study, so basically that's the endpoint. So about only 0.08% related hospitalization or death from any cause through day 28. And then they actually found there were about 88% relative risk reduction of patient to be hospitalized. And then there is actually zero all-cause mortality amongst the Paxlovid arm compared to the placebo arm. And then they actually look into more if you actually start. So generally 88% risk reduction, but if you start within the first 3 days of symptoms, it's actually much higher than your risk reduction of mortality and hospitalization up to about 89%. Whereas if you start within 5 days of symptom onset, it's about 85% macam tu. So generally it's very good lah. It's more than more than 80% of risk reduction. So that's why a lot of international guidelines and everywhere is actually, and FDA actually approved that the use of Paxlovid here. And also when you look at viral load reduction at day 5 of the illness, if you start the Paxlovid, there will be a 10-fold log reduction of the viral load, compared to the placebo arm. All right. What about side effects of Paxlovid? Of course, any drug would have side effects, kan? Tapi looking at the adverse events here, it's generally about only 1%, and the common one is this dysgeusia, if I pronounce it. So basically, this is altered sense of taste, kan? Altered sense of taste. They feel macam uncomfortable kind of taste. I don't know. We have not had an experience, but they get metallic taste, yes. This dysgeusia, and then some will get diarrhea. Itu je. Mainly dia punya side effects. That's it. Yeah? About 1%, and the majority of the events were grade 1, grade 2, and they resolve after you stop the treatment because the treatment is only 5 hari. It's not long. It's very short course. Yeah. So that's that. What about pregnant ladies and lactating mothers? Again, there are no available clinical data on Paxlovid. All right. So it is actually contraindicated until we get more evidence on it. Pediatric population, there is an ongoing EPIC-PED study for PED 6 to 17. So dekat Malaysia, it's only licensed 18 years old and above. Tapi kalau you tengok dekat FDA ataupun even up to date, they actually license it to use more than 12 years old, but it's actually for EUA lah, conditional use. But untuk kita ambil 18 tahun ke atas. But until this EPIC-PED study later, hopefully you'll get more evidence to use it lah. Dosage modification. So Paxlovid is a combination. You just ingat nirmatrelvir tu 300, ritonavir tu 100. So 300/100. We give DD dosing untuk 5 hari. Tapi itu untuk creatinine clearance lebih 60 lah. Kalau creatinine clearance antara 30 ke 60, you kena halfkan nirmatrelvir tu. Daripada 300, you halfkan 150. Tapi ritonavir masih sama. Ritonavir tak affect dengan renal adjustment. Tak perlu renal adjustment. Still take DD 5 hari. So nirmatrelvir tu je you kena halfkan. Nanti I think Wilson will show you the package because dia dah siap satu patient, satu packing kan. Ada 30 pil dalam tu untuk 5 hari. Sebab dia dah asingkan. So dia kena makan nirmatrelvir dengan ritonavir. So macam combination therapy. Dia bukan 2 in 1. Dia separate loose pills. Okay. And then those yang creatinine clearance bawah 30 memang not recommended to use. So that's that. What about liver impairment? Dia tak specify the function of the ALT, AST or whatnot, but generally dia orang tengok the Child-Pugh classification. So kalau Child-Pugh C saja is not recommended. Kalau AB, no issue. Okay. Those yang kalau datang dengan transaminitis, it's not an absolute contraindication. You can start, but you just need to monitor the LFT closely lah. So I think that's that. So this is the one, because remember the EPIC-HR trial, majority of the strains were Delta. So looking at this, they were extrapolating, looking at in vitro efficacy of this Paxlovid against Omicron. They found that it's actually effective against Omicron as well. So that's why Paxlovid is actually indicated lah for as an antiviral during this time. Right, so this is the guideline. I don't think it's out yet. I tengok dekat website NX2E tu dah tak updated lagi. But this is gonna be, kan dah keluar? Yeah. So this is actually the draft copy. Looking at it, so generally bila kita nak guna Paxlovid, you just remember category 2 dan category 3. Yeah, that means symptomatic patients ataupun symptomatic patient without pneumonia lah if you have a chest X-ray. So you need to have category 2, category 3, and then it has to be started within day 5 of illness daripada symptom onset, within day 5. And then there is a scoring system. I will share with you the scoring system. Kalau dia score 3 dan ke atas, consider Paxlovid. Okay. So nanti kita ada checklist yang which we have done, the pharmacy department has done for HKL. It's easy, you just tick the box and then tengok lulus ke tak lulus. Okay. Again, here ada remarks. Saya tulis kat situ creatinine clearance as I've mentioned earlier. Tak ada data in pregnant and breastfeeding mothers. And then drug-drug interaction is actually very important. So actually banyak dia punya drug-drug interaction, even I also cannot memorize. You can actually upload in the app, in your Play Store or your Apple ni. You can upload, what is it called? University of Liverpool drug-drug interaction. It's meant only for COVID drugs. There's an app. So you can actually upload there, you just key in and then dia tengok lah interaction ke tak ada. Itu saja. Tapi I think there'll be a list of drug-drug interaction I boleh ingat is basically you just have to remember anticonvulsants, antihypertensive, right? Calcium channel blockers and statins. Itu je yang penting lah. Of course, anti-TB also lah, rifampicin and anticoagulant. Itu je yang the most important drug-drug interaction lah. Tapi nanti we can go through later some case. Right, so this is a scoring system. It's in the guideline. It's actually meant to be used for the FMS, but Paxlovid ni memang initially to be used in KK dengan CAC. So they've already done the 6 criteria here. Depending on all this, and there's a score here. Yeah. So age, according to the age range, immunocompromised condition is very strict. Dia ada guideline, dia punya criteria. Kita kena refer. Comorbid, setiap satu comorbid dapat 1 point. Yeah. And then vaccine status, obesity ke tak, or ada chest X-ray changes lah if you have chest X-ray. So if you score 3 atau lebih je, it's already within day 5 of illness. Creatinine clearance more than 30 depending on the name, so they should be able to get Paxlovid. So kalau you tengok scoring criteria ni, is very easy to get patient. If you have already 70 lebih tahun, dah 2 markah dah kat situ, hypertension 1 dah 3. So so that's why Paxlovid ni would be rolled out very fast. That's why, but hopefully maybe have 3,500 patients. The ubat will expire January tahun depan. So I don't know how is it like. In the meantime, hari tu Dr. Leong minta kita kotakan dulu. Maybe in a day, you just start 10 patients first. So we share macam 5 dekat ED, 5 dekat inpatient. Tapi as time goes by, we see how the pick up ni, that we can always increase lah. Because I know like in Sungai Buloh pun dia orang kotakan dulu tengok. So kita baru nak start kan, so kita tengok how is it like lah. And nowadays pun alhamdulillah, I think patients yang actually come into ED with COVID actually less in terms of mild symptoms kan. So they probably go to KK or CAC, so we don't know lah. But I don't know lepas raya nanti macam mana. Okay. So this is a list of immunocompromised condition lah. You boleh baca lah. They're quite strict there. So if you meet on any of these criteria, then baru you consider as immunocompromised, and then you score 3 terus. Kalau ada tu terus 3. So terus dah boleh dapat Paxlovid. Okay. Alright, itu saja. Any question, or maybe Wilson can present first, then later I'm happy to take some questions lah if you have.